like 12, 13, and then it goes up and up, and we don't take care of it so much because we thought we go about working, it will come down this way, and then the doctor, I end up getting viral infection 2 years ago. Went to hospital, take out the virus from my leg, and the doctor advised me to cut it down because that time my sugar level is about 18.
18.
Yeah. So the doctor should take out to the operation. The doctor give me constant check of insulin to bring the sugar level down to something like manageable, 5, 6 to do the operation.
So the endothelium is your left or right leg?
My left leg.
Left leg. Left leg virus infection, so doctor advised to cut down. Is it cut half or whole?
Huh? Do I have to show that?
No.
No, if I have to show that, then
So is it already make an operation?
I fall down.
If you don't mind, we can take a photo.
Because the support is still there.
Okay. Oh,
Operation is about
operation set.
6 inches long, and then the whole leg swollen because of the viral infection.
Excuse me, can I take a photo?
So the operation is about that, right?
The swell is about over here, and then they cut this line. You know, hospital they just cut, and then they will just want to clean it out. And when they clean it out, take out all those this and that. And then that time, my diabetes level is still about 7, 8, and then they keep it very low. And then there's when I was lying in hospital for 1 year.
Lying on the hospital for 1 year. Is it 1 year?
Not exactly 1 year. It's about 6, 9 months like that. And then once they get this done early, to recover, they say give the kind of one maybe about a year or so. But then I start searching for Chinese medicine, get some Chinese medicine and sealed up, and then it improves. See, what the diabetes do, the diabetes make the flesh very clumsy, very, very wet, and then your flesh will never come back together to
Yeah.
It's very difficult to
Recover.
recover. It takes about nearly a year, but then I got my recovery to about 1 month and a half. I recovered.
When are you start to take moringa?
Moringa comes in after that because after months of recovery, my sugar level is still quite high. Then we continue to take tablets after tablet, and they continue to change until they tell me the tablet is not good for the kidneys. And then finally, a few months ago, about 3 months ago, my kidneys started to fail. When my kidneys start to fail, the creatinine level is about 300 plus. The doctor started advising me to prepare yourself to go for dialysis.
Your kidney problem is after the operation.
After the operation, way after the operation. And then they prepared me from the dialysis. I start feeling it is very, very painful because everywhere you find movement of the legs, the hand, muscle ache. So I could hardly walk the distance and get up of bed. Without the sugar, never mind, but when the body, the kidney start throwing away the protein, you can't even walk properly. We could drag ourselves out of bed, do the changing and all those things. And then after a week or so, one of my friends called me up and I tell him I'm going through a lot of trouble. Preparing to go soon, but then they tell me we bring down something nice for you, and then they bring moringa for me to drink. And then after taking it for 1 week, I start getting back my strength.
When are you started to take moringa?
About 2 months ago. I take it for about 2 months ago.
Do you heard that your eyes have a bleeding?
Eye bleeding was internal. See, when your eyeball is full of sugar, the capillaries need to be lasered to cut down all this bleeding. I went for the lens transplant. I got the lens transplant on my right eye, and then after that they advised me to go for laser. This and that. I just refused to do the laser part because they say, after lasering the eye limitation, your angle of vision is much less. The distance you can see from far is much less. So I didn't make a decision of that until the day comes when you start bleeding.
The bleeding because of the diabetes also.
Capillary, the accumulation of sugar in the eyeball, when the capillary gets bulged up, it gets bigger and bigger, it bursts. Like a balloon, it bursts. When it bursts, you can see the blood flowing down. When you bend down, you see the blood flowing down. And then when you get up, you see the blood droplets, blur up your whole eye. And
So can't see anything.
you get black. Yes. And then
Is it happen frequently?
Huh?
Is it happen frequently?
Or when it happens, it's bad. But now it's drying out. So when it dries out, the dirt is still there. You see, I may still have to go for another round of operation where they laser it up to clear all the dirt like that. But then if I were to go to the hospital and they tell me to sign this, sign that, then I wouldn't do. Because they are pretty smart. You go to the hospital, they don't care so much of what your health is on. They care of what they call getting the job done. And when you get the job done, what happens to the patient thereafter is not their business. They get the job done. That's why they ask us to sign off so many things which I refuse to sign. So from there on, the decision cost me my eyesight. Now, the eye is improving. The vision is coming back, but then it is a little bit slow because the dirt is still there. So at times, at night I cannot see. Now, daytime I can see shadows. The shadows I can still see.
But daytime, can you see clearly?
Yeah, my left eye is still blue, so I can still see clearly.
At nighttime it's blurred.
Nighttime, the vision is a little bit impaired because short brightness.
You told me that your friends they introduced you to try the moringa, right? 2 months ago. What you feel after you try this product?
Initially, it's a little bit slow, but then when you start getting improving, there are a few things that we have to do, like putting back the normal food. You see, when the kidney start failing, the amount of protein food you can take is limited. So you choose which one you can take, which one you cannot take.
Yeah.
Right? So when you take moringa, the pain at the back, the kidneys, the pain is much less, the strain is much less. That is why we got to start taking it. If you don't take the food, it sort of dissolve away the sugar fast, and then you don't take enough food, you find that you go
No energy.
a bit what you call it, putting like that, you know, you feel dozy, and then you feel like to sleep. So when you sleep, you tend to sleep very long time because you are short of protein, and your body like to sleep. It's very nice to be what they call it, to be dead than alive that time, you know, where you lie down, oh see, very nice, very happy, you know. But then the moment you get up, you find you don't have the strength. That's why from there onwards, after taking moringa for 1 week, I realized my sugar is going up. I start pumping some more insulin. That's why I realized my body start dissolving, taking food and dissolving the sugar, putting the sugar back into my blood where I must dissolve it. So from there onwards I take in more insulin, and then after that it goes in to balance out by itself. And now I do not take much insulin. I do not do any injection also, unless I overeat lah. If I overeat, then I take more. If I don't.
So what is your sugar level now?
Sugar level is about 6.2, 6.3, below 7. It is very, very nice figure. So from now I got energy to move about.
Then how about your kidney?
Kidneys. For those who are suffering kidneys problem, there's one major part is cannot take much oil. Those oily stuff, oily food, it will create pain by the kidney. That's why you take moringa, and moringa will clear the pain away, and then you use food, sort of you get sort of comfortable. But then you cannot take too much of those fats. The best is still the fish oil, of course. If you have lack of protein for a long time, you find that your muscle aching, your joints start aching. That's why your fish oil, you must take back the fish oil. So when I take back the fish oil, I have to go with moringa, and then I have to see the amount of food I take with the fish oil to suit things out and get back the energy for me to go back to work. So now I'm sort of weak, but I can still move about. I can still do things without much difficulty. Except here, of course, here as I walk a little bit, muscle ache here, something like slightly spastic, but then still okay because after some time. Even if I sit after some time, I get up, I have to stop for a while, let the blood circulation flow, and start moving. Otherwise, I'm also in very short of blood because once the hemoglobin was used up, it takes some time for it to come back. So from there onwards, I put in all those stuff, start eating this, and then we pantang here, pantang there. The only pantang I have is the carbohydrate. So I got to keep the carbohydrate to the minimum, to what I need. I cannot take more than what I need. Then it will give me a lot of problems. The protein, I cannot take much meat, so I take minimum amount of fish, this and that. Meat less. And then I go in with the fish oil.
Okay. The main problem is because of your diabetes for more than about 20 years, so it affect your kidney, affect your eyes.
Yeah, that's why you go to the Western doctor. Diabetes, you take this medicine, you take this medicine, you take this. You got
And
the
it affect your kidney.
high blood pressure. They give you this medicine, this
Yeah,
medicine. They don't check what are the side effects.
Yeah.
You see, and then later on when you get the side effect, they start changing the medications. But then the effect, they won't tell you the effect is the medicine that they give you, you know, until you realize, wow, all the medicine loading inside, no wonder my kidney getting into trouble. I went to the hospital, do the operation. The hospital doctor start taking away the medication that I've been taking from the clinic. Yeah, they say, this one is not good for you. This one no good. And then they give me another set of medication like that. After that, sets of medication, they will have to balance it up between my blood pressure and my kidney troubles. And from there onwards until now, I still take the hospital medication only for my blood pressure, for my kidneys and that.
No. And the diabetes, you stop the medicine?
Diabetes, like I say, the insulin, I still pump in some insulin when I overeat.
Okay.
If I don't overeat, I don't. If not, if I pump in suddenly, the result is fast, I will feel giddy. And
So you check your blood pressure.
Yes, almost every day.
So it depends on the situation. If the level is very high, you put the insulin. But it's
Yes.
not, it's normal, then just give it.
And when I take normal, I don't go overboard. I don't fast also because the effects on my body, I can feel when my fish, when I'm short of sugar and I'm over sugar like that. Because even the testing itself all very costly. One strip is RM2 in
Yeah.
Malaysia.
Yeah.
And the needle and everything is very costly. So somehow, for the poor people, they may not afford for the well-being people, they go bankrupt with it. They continue testing like that. And then you go dialysis, they return dialysis. One week, 3 times, and you go 3 rounds. 1 round is 260.
Yeah.
If you have membership, you don't have membership. If you're not Malaysian, they charge something like 500 ringgit, 500-600 ringgit 1 round. I say no, I'm not going for dialysis because it makes the vegetable out of me.
So what do you think when your friends introduce you the moringa? The first thing in your mind, do you accept it or you just try it something?
Oh, I tried so many medication until I learned to realize that whatever the hospital gives us is more on maintenance of health that provides no cure. Because I've seen diabetic people going in and coming out, and then after 3 months suddenly disappear. So from there onwards, I learned to accept life is like this, and then we got to do this to maintain ourselves. If not, prepare to go. That's all. But don't ever have kidney failure. Kidney failure is very, very painful. And kidney failures, the kidney provide nutrition to our whole body. When we are short of that, we find that the heart starts failing, the eyes start failing, even the eyes will blur off. And sometimes I feel very shocked, how come my eyes blur off? So now I realize short of sugar, I take in the sugar and then the vision comes like that.
When you find out that your eyes is bleeding, when it happened?
Eye blur when you're short of sugar. When you're short of sugar, you see a person, you cannot focus the vision properly. The vision tends to blur off like that. And then you find your head start feeling a little bit free or control or what is in the wrong. Then once you know that it's short of sugar, so you can take no sugar like that.
So you didn't do anything for your eyes?
Eyes, or went to get it checked out, and then they tell me to wait for laser and this and that. I just don't want to take that risk at the moment yet until I think I get back my energy when the eye comes in. Because when you work hard, when you do some hard work, the blood goes into the eyes in, what should I say, high pressure. So that's why you have high sugar content by the eyeballs. When we work hard, the blood pressure becomes more, and then it bursts up all those small capillaries, and then from there we see a raining of blood inside your eye. Outside you see normal, nothing. Inside, bleeding.
Bleeding inside, not outside, right?
Not outside. And then we have
So
to
the
wait
white,
for months to clear.
so your eyes become red.
No. You never see the red
You
color.
can see. How do
Unless you see through a scope, then you see the blood mark is there.
Okay.
But if you see in the mirror, you don't see anything.
It bleeding out
It is
inside,
bleeding inside.
but from the outside we can't see
On the
anything.
outside, you cannot see anything.
But when it's bleeding, you feel blur, right?
Black,
Black.
the blood is there, and the blood color black.
Can't see anything.
Can see it. When it start clearing off, like now it start clearing off, you can see the shadows, you can see all this movement. Now if you put the fingers in front of me like this, I can see 3 fingers, but then you move a little further, it's blur, I can't see anything.
Is it both sides got the same problem?
No, only one side. Both sides got the same problem, but then I stopped them from changing the left side. I don't want. Then you see, when you have the real lens can absorb the blood faster. When you have the false lens does not take away the blood. The false lens keeps all the dirt down there around the lens, and then from there you see blood. Even though the blood already dry off, you see blood because there's no cells there. It will not take the blood away, and then your lens it may functions, but then the vision blood. That's why you got to go back hospital, take out the lens, clean out the lens, and put it back like something like that. Then we can get the vision back. That's why we're waiting for it to clear out, and then we see if we cannot, then we go back hospital and we go back there.
Now is your vision clear?
Now vision blurred.
Mm.
I see one eye.
Left side is more worse, right? Right side is better.
Right side is with the artificial lens. Left side is with normal lens. That's why now I see mostly on the left side. When I drive also on the left
Still
side.
can
But
drive.
Angle of direction I got to find myself. So sometimes the vision is not towards that one. I have to be very careful.
Is your eyes better after you take your Moringa?
Pardon?
Is your eyes, your vision is better after you take the Moringa?
Moringa helped me to reduce sugar and the bleeding stops after that. After 3 weeks of Moringa, the bleeding stops. Now the drying process takes a longer time to clean up. Our body will clean up the thing, but then it takes a longer time.
Anything else you want to share?
Nothing much, except that
Are you still working
never
on
get sick. Get into this kind of sickness.
suffer,
To
right?
recover back takes a long time. Very irritating. And when you get up, you try to do the things that you normally do. Sometimes you cannot. And sometimes you find that as you walk, you miss your steps like that.
Yeah.
And then people call you old man after that. That's usually when I used
Are you still working or retired already?
Intend to go back to work. Retired means waiting for the COVID to happen. Because if you don't get moving, then you find that the circulation becomes worse, and you find that we love our bed much more than going about doing things, and then one day you just sleep throughout. That's all. That's why
Thank you.
it's kind of difficult phase of life to go through. Once you go through that, you become so happy, you see so many solutions. Earlier it was no solution, nothing. You got to accept what the doctor says, what the doctor give you got to accept, and then you just take, and then wait for the topic to come, and that's it. But now this is, I went out searching for so many things. And Moringa is one of the things I'm waiting to happen.
So if you got a hope
Sort
for
of
the future.
lucky in a way when the medication comes in at the right time. Otherwise,